Hi, this is Dr. Vance Raham, lead addictionologist for Tanner Health Systems based in Carrollton, Georgia, and our behavioral health unit called Willowbrooke that's in Willowbrooke, Georgia. We're going to be talking again today about how the COVID virus crisis is interrupting our ability to help people stay into recovery. But today it's not going to be about us. It's going to be about friends and family members and what we call surprise addiction. When I was doing medical and surgical sort of medicine and admitting people to the hospital, we would have patients who, a couple of days into being in their hospital stay, would suddenly have major changes in their mental status. They'd be confused, they'd have hallucinations or delusions. They'd also have symptoms of like a stomach flu, which is technically not the flu, but they'd have a lot of gastrointestinal symptoms. And we would figure out after ruling out medical reasons that they actually would have an addiction issue. And the patient would finally admit that yes, they've been a daily drinker, or they were taking benzodiazepines that have been prescribed by their physicians for a prolonged period of time and at high doses, and were now going through withdrawal. So we would detox those patients and get them well and send them home. What does that have to do with today? Well, there are friends and family members that we have out there that we probably had concerns about, and how much they've been drinking, or how much prescription medications of opiates or benzodiazepines they've been taking over a long period of time, or sleep medicine like Ambien and Sonata and that class, or muscle relaxants like Soma. At this point in time, because it has been changed what our social life is, we are now not going to the store as often. We're not going to the liquor store as often. We're not going to the pharmacy. We're not going to a bar. The people that are used to having a steady stream of their drug of choice is probably going to be interrupted. These are the people we're going to suddenly see at home start having changes in their mental status. They're going to be confused. They may have seizures. They may have hallucinations. They're going to go through DTs. And they're not going to know what to do with this. And we need to be aware that this may be happening to our friends and family. So first off, stay in contact with your friends and family on a daily basis and make sure they're doing well, especially those you may have had concern about. If you find that you have friends or family members that are now having a major issue, they need to get to a detox facility as quickly as possible. You may be able to take them to an emergency room and get them stabilized, but honestly that is also a threat to them because they may get exposed to a virus when going to an emergency department setting in a hospital. So if you can get them to a place like we have, which is a behavioral health unit that's separate from the hospital, we can take them on an emergency basis, stabilize them, detox them, and get them ready to be emotionally and physically and psychologically ready to continue on with a addiction treatment process. Why is this important? Well, it's important because people going through withdrawal from alcohol and benzodiazepines can have life-threatening seizures. So that is one of the major treatments that is done in a detox facility for the patients on those different drugs. People that are on opiates are going to feel like they're going to die, but they don't. It's just a terrible feeling. So going through the symptoms of withdrawal can make a patient not be able to work a recovery program once they get free and clear of the drug. So going through a detox programs allows us to get people into a good emotional, physical, and psychological state where they can walk out of detox and start a recovery program and be able to participate in that in a virtual setting at this point. So let's keep an eye on our friends and family, stay in contact with them, watch out for yourself, keep yourself healthy, keep yourself virus-free, and it will be great to see you again somewhere down the road in the rooms when we can start having real meetings again. Thank you and have a great day.